With all forms of soft tissue healing, we obviously have to be careful not to overload the tissues when they are vulnerable. But we also have to avoid underloading the tissue. An appropriate level of stress actually helps the healing tissue adapt to that stress. Let's look at the stress-strain curve. When stress is applied to any tissue, the slack is taken up and the tissue will undergo some strain. And we're talking physics here, not a muscle strain type strain. This strain can result in adaptation. However, when the stress passes the tolerance threshold for the tissue fails, becomes damaged or injured. So no stress causes no adaptation. The right dose of stress causes a healthy adaptation. We get stronger, more mobile, better bone density, thicker and stronger ligaments, improved cardiovascular fitness. But too much stress results in injury. The stress-strain curve and tissue adaptation is important in injury management, but it also applies to activities and training beyond injury. Load is the stress applied to the body, and our capacity is our ability for our body to handle the load safely. As tissues adapt to appropriate loading, our capacity for loading incrementally increases. So if we're regular and gradual with our loading, we will continue to adapt and increase our capacity for future loads. Loads that were previously considered too much and would have resulted in injury are now very manageable and helpful. On the flip side, if we stop loading regularly, we may start to lose any gains we've made and our capacity goes down. Now loads that were previously very manageable, they've now become excessive. Now for many of you, this load management part of the equation is well understood. The focus on capacity is a little more often overlooked. We know how to increase our capacity in one way, through appropriate loading, but what about all the things that can increase or decrease our capacity? We will talk about these in more detail later, but some of the common things that can affect our capacity are sleep, nutrition, stress. So here's the really good part, and this will be on the test later, so pay attention. So long as we do things to support our capacity and we're loading regularly and only gradually increase, we'll tend to stay healthier, stronger, and more resilient. Sure, our 20-year-old cells could take a few weeks off, come back hard, and be no worse for wear, but those days are gone.